welcome to this instructional video on the contraindications of active assisted and passive range of motion exercises in the ICU setting. I'm Shay, and today we're going to be discussing how to safely perform range of motion with common line strains and tubes found in the ICU. Active assisted range of motion and passive range of motion are essential techniques used in the ICU for maintaining joint mobility and preventing complications like contractures or stiffness, especially when patients are bedridden. However, when the patient has lines, drains, and tubes in place, certain movements and positions may be contraindicated due to the risk of dislodging or damaging medical devices. Today, we'll go over common lines and tubes in the ICU and discuss contraindications for active assisted range of motion and passive range of motion exercises based on their location and purpose. Let's start with a few of the most common lines. A-lines are often placed in the radial artery or the femoral artery to monitor blood pressure continuously. When performing range of motion, we need to be cautious with any movements that might occlude that vessel, causing an inaccurate reading to the A-line. If the A-line is placed in the radial artery, avoid wrist flexion and extension, keeping the wrist in a neutral position, and only performing shoulder, abduction, flexion, and elbow movements. If the A-line is in the femoral artery, avoid excessive flexion of the hip. If a patient has a femoral sheath catheter, range of motion is contraindicated for the ipsilateral lower extremity. If a patient has a vas cath, usually located in the neck or groin, they may be undergoing dialysis treatment or CVVH and CRRT. If the patient is currently undergoing hemodialysis, it is contraindicated to perform any range of motion during that time. You can, however, mobilize during CVVH or CRRT as long as you do not compress the vas cath during that treatment. Connected to this machine is a clear fluid-filled tube that runs along the ground. Be sure to not step or roll anything on top of the tube as it impacts the integrity of the machine. When working with intubated and sedated patients, it is good practice to not flex or abduct their shoulder past 90 degrees due to risk of subluxation. In addition to the specific contraindications that we've discussed, always monitor the patient's overall tolerance to the exercise. Watch for signs of discomfort, for changes in vital signs, and for facial grimacing or tensing of the muscles as you're doing exercise. Remember that safety is our top priority. When in doubt, always check with the care team and your CI to see if you're using the best technique of mobilization with specific medical equipment. With careful attention and proper technique, we can safely promote joint mobility and improve patient outcomes in the ICU.